Hi, everyone. It's Rachel Byrne here, the Executive Director at the Cerebral Palsy Foundation, and I am thrilled today to be joined by Minnelly Vasquez, who is a social worker at the Weinberg Family Cerebral Palsy Center at Columbia University in New York City. And today we're going to be talking about cerebral palsy and mental health and different opportunities that you can look at in what services can be provided, as well as things that can be done. And so obviously, welcome. Thank you for joining us.
Thank you for that beautiful introduction, Rachel. So at the Weinberg Family Cerebral Palsy Center, we have a wonderful program which is dedicated to really looking at the cerebral palsy care throughout the entire lifespan for the individual with cerebral palsy and the family members who are involved in the care. Now, to take a little bit of a step back and say a little bit about me, because I know you introduced me first, but I went straight to talk about our wonderful program. So I'm a licensed clinical social worker, and I received my master's in social work from Fordham University. And when I went to Fordham, I focused on disabilities and the aging population. And ever since I graduated, I was always within disabilities and aging in all aspects of what you can imagine. So that's a little bit about me and about the wonderful program that I'm a part of at
I know,
Columbia.
and the centre obviously is so lucky to have you with obviously your experience, your background, and all those different things, because I think we know, just how important mental health is. And obviously we've just sort of come out of a pandemic where I think mental health has sort of come to the forefront for a lot of different people. But, it is also extremely significant for those with cerebral palsy across the lifespan, as well as parents and caregivers and the whole family network as well. And so Minnelly, I'd love you to sort of address that a little bit too. So what do we know about mental health and cerebral palsy, and, what can we do about it?
So with mental health and cerebral palsy, what we know is that there's very little research on it, like actual research just on cerebral palsy and mental health. So there's a huge need for that to be a little bit more of a focus in the future, in my opinion. And then also just talking with other mental health providers who work with cerebral palsy community and psychiatrists and other folks, and even here at the Weinberg Family Cerebral Palsy Center, we see that the mental health needs are much higher than like the population that is outside of the cerebral palsy community. The mental health needs are higher for multiple factors. One, there's isolation. There's also not as much socialization, and those learning experiences that you have sometimes at school, at workplaces, at different activities. So there's a lot of mental health needs based on just that social piece, because human beings, we are social creatures. We need to be interacting, and that helps our emotional growth. And when we don't have access to that emotional growth, our mind, which is a powerful thing, it can pull us down or lift us up. And when we don't have that social connection, it pulls us down.
Yeah, I think that's so powerful, right? And I think that is something that has been exacerbated in the last couple of years for lots of different people and for lots of different reasons. When we're talking about mental health, what types of things are we talking about here? Because obviously mental health can be very broad, right? It can mean lots of different things. But what are some of the common mental health things that you see?
Some of the common diagnoses that I see in the CP community is anxiety. Anxiety, which completely understood around social interactions, whether they're going to be in a population or in an area where there's not going to be many wheelchair users or people with physical disabilities. Anxiety around, transitioning from high school to college or from college to the workforce. That is one part. I also see post-traumatic stress disorder, PTSD, from different circumstances that have been unfortunately due to an environment not welcoming their physical disability, and also parents and what they go through when they're giving birth to a child with CP, and then not being able to have those first few hours or those first days that most parents have with their child of just constant connection and touching. Other mental health diagnoses are depression for sure. And then what can make it even trickier, which is really, really hard, which we're all still trying to figure out, is a personality disorder. They're not common, but it can happen.
Sure. No, and I think these are things, though, when we're talking about PTSD, when we're talking about anxiety, and we're talking about depression, they are common. And these are things now that we do have ways and different therapies and different things that we can do to help. And I think this is the main thing, right? Is to actually go, okay, for these different pieces, there are things that can be done. And, and it's not actually also, there's lots of parents that are going to be listening to this as well. And I think, you touched on it a little bit, that for parents, particularly if you've had a baby who was very premature and had that experience in the NICU. PTSD after the NICU is a real thing. And, making sure that also the family unit is healthy and their mental health is sort of as best as it can be as well, and not just necessarily the child or the adult or sibling or whoever it might be. But when we're sort of talking about those sort of high risk traumatic experiences that happen from PTSD, what are other things? You sort of touched on it, sort of, I suppose, isolation can be, or those constant, I suppose, we talk about microaggressions and those different things. Can these lead to PTSD? Is that something that can happen?
Definitely from what happens with the childbirth, and for sure in NICU, and also just the upbringing of a child with a disability. Like, I've been working more lately with families and parents, and like that has been something, like I made it a point here at the CP Center. Like, I want to work more with some parents. I want to have to be able to understand the whole family unit of what's going on with CP and them in their lives. And in particular, the last thing you touch on, which is the microaggressions, what I've seen is that when the child is very young with CP, parents become just a devoted advocate. A lot of parents become a devoted advocate to their child, and then I see them wearing themselves down and not as much pouring into their cup and just pouring it all out to make sure my child's needs are being taken care of. They're included in the classroom. They're getting all of the special needs educations that they can get. And I just see all of this happening. And then I'm just wondering, like, when are you going to take some time to join that group and do some session and connect with other people? When are you going to call on your community and your village that you've cultivated to be able to get back in there? And they're like, no, I can't. I have to do one more thing for my child. I have to do another thing for my child. And it's okay to take care of ourselves. I remember a teacher said this to me a long time ago, when they said, the best thing that you can do and you can teach your child is, because they learn by just seeing us. And for example, it's like you take a break and they see, like, oh, mommy's taking a break, daddy's taking a break, my parent is taking a break just to relax and take care of themselves and to be with people who are going to love them.
Yeah, no, and I think it's really important, right? Because when we're not our best selves, it's really hard then to give that to somebody else. And I think, you've mentioned on a couple of different tips on how to do this, because I think that's the tricky thing, though. It's like, all right, it's great to be told, okay, you need to take a break. It's great to be told these different things. But do you have any tips for parents or caregivers as it relates to their mental health? And what are some of the things that they can do?
Okay, what are some of the things that they can do? So right off the top, which is some of the hardest thing, is like scheduling it in your calendar and then adhering to that schedule, because the task and the schedule always shifts. And it's like, oh, maybe tomorrow, maybe the next day. Sometimes, and in particular, what I like to do is, like, for example, at the CP Center, we have a monthly support group for family members. Yeah. So like they get reminders of like that one time a month, it's 1 hour. It's just 1 hour, one time a month that they have to block out and then just spend time with other folks and talk about and vent, and then also get a little bit of love back that they pour out to their family. So that's one part. Another piece too is that if things don't line up, that you can't socialize with people, music is so powerful. Like, there is a lot of research around how music and sounds are very powerful. I'm a big believer in meditation, in particular sound bath meditation. I've been reading more knowledge around sound bath meditation, that it's literally a massage for your brain. Like,
yeah, these are all these timeouts, right? That we live such busy lives that we never just take that moment to be like, okay. And the acknowledgement, I think that's really powerful too, to be like, maybe I'm not feeling okay. particularly if you've had a traumatic experience in the NICU and you've now, 2 years later, and you've, got your child into early interventions, you've got the diagnosis, it could very much now be like, oh, hang on, I'm not really okay. I need help, and reaching out for that help. And so the question for you there is, how can parents and caregivers find resources to help? You've talked about, obviously, the Weinberg Family Cerebral Palsy Centre has wonderful programs, and it's a priority that you've made for it at the centre. But what other sort of mental health resources are out there for families?
So I wish there was, which is like for anybody who's listening, this is like a great business idea of a training for mental health on CP and providing CP mental health care needs and doing specific interventions for the CP population. Anyone who's out there listening, there isn't such a listserv like this specifically. But what I have found that is helpful is that you just look at specific things. Like, some folks with CP do not experience chronic pain. They might experience chronic fatigue and physical disability. So looking at therapists that focus a little bit more on that. What does chronic pain and chronic pain and physical disability? Some websites that I particularly like, where you can even schedule a 15-minute call with a therapist, like the next day if you'd like to, or in the next week, just to see if you would be a good fit, is Headway.com. It's not nationwide, but they do have about 20 states listed where they have therapists, where they can be seen via telehealth in a platform. Another platform is called Alma. So that's another space where you can request a call for a therapist, like let's say next week, 15-minute free call, check out to see if it's a good fit for you. And they focus on all things like caregiving, parenting, physical disability, chronic illness, pain management, and like treatments on that. Talkspace. There's another, betterhelp.com. So those are some of the resources, and I'll make sure to email you Headway and some of those other ones that are not as commonly known that I know about.
Yeah, we can put it in the comments for everyone who's watching as well, to make sure that, if you do need access to these different things. And I suppose, just as a piece, if you are in a bad way, or if you are feeling like you're not coping, please reach out. There are people absolutely who are there to help. There is the National Suicide Prevention Hotline. There's all those different pieces as well. And also, go see your doctor if you're feeling, that you're not being able to cope at this point in time. So, for families, obviously, getting those different resources that are sort of a bit broader. But speaking about cerebral palsy specifically, you spoke that there's not a lot of resources that are available that are specific to CP right now. But when we think about looking at mental health issues across the lifespan, and if you have cerebral palsy, what age should children or adults be screened for mental health issues? Is this something that can be common to go ask, to have those questions asked? Is that something that's available?
I think it should be done throughout the entire lifetime. I think it should be done every year as part of your physical check-in. It's like, how we have our annual visit with the doctor. I think that should be part of it. Like there's a PHQ-9, which is a very standard 9-question questionnaire just to see if whether the patient is at a high level of scale of depression or not. It should be administered every year. But if I had to choose like a particular age range, I would say the transition of, let's say high school to college, or even not even college, just like transitioning out of high school, like what's going to happen with their life. There's, at that age, teenagers, I should say, are still developing hormonally, and they're still very much coming into their own, and emotions are heightened, and it's a huge spectrum that they can experience within a day. So which is, I think, that age range, if I had to choose one, I would choose that age range in particular, because that's one also that we saw during the pandemic. We saw a lot of spike in depression, a lot of spike of suicidal ideation.
Yeah, no, definitely. And I think it's sometimes as well where, teenagers don't necessarily feel comfortable talking to their parents or, somebody else. So finding who they are comfortable to talk with, and, having that idea that therapy isn't a bad thing. Like those, sometimes we just need to talk to people. Sometimes we need to talk through our feelings and our emotions, and come up with those different ideas of how to get through the next steps. for then teenagers, because we're, now talking about that and their transition to adulthood, what about self-advocacy? What about some of those different things? What's available for them to learn those skills? Because I think this is a wonderful thing for sort of us to say, but, that's actually something you need to learn. It's not easy to actually necessarily be able to self-advocate for yourself and say, this is what I need, or this is how I feel, particularly if you haven't done it before.
Yeah. So thinking about this, like just in the medical setting, it's like, so here within like our doctor's office, like let's say if someone needs to be treated for something specifically, we do like a warm hands off, which is the primary provider being their part of the medical visit and introducing the other provider who's going to help with these other aspects that the primary provider is not as knowledgeable about. So I think about that, and that concept of the warm handoff is like, us providers, we kind of need it too, because there's going to be a whole new dynamic that's happening. I'm speaking just here in the medical setting of like having parents and children having that very clear and transparent conversation of, I want to start now being more in charge of my the medical pieces of my life, and being the one deciding more and speaking up directly to the doctor. So having they can have that conversation first, and then slowly having that warm handoff with the provider. So that's like a great place to start that and implement those same techniques in different spaces. When you go to the financial aid to apply for financial aid for college, when you go to apply for a job and you do that job interview, like just learning that piece, because a lot is learned within a provider and a patient interaction, as I've been learning with all of our patients, that can be repeated in different patterns in their lives.
Yeah, that's actually something that's really, something to highlight actually, is the fact that the skill set that you do need to be able to communicate with your doctors and to be able to communicate with your healthcare team can be used elsewhere, and can actually, be utilized in those skills that you learn, and in a way start to develop with your healthcare team. Sort of next question. So these are sort of things, okay, look, there's lots of different things we can do for mental health, whether it be, as you said, therapy, journaling, meditation, all these things to help us with different coping mechanisms, strategies throughout the day. But sometimes, medications are needed and are required for mental health needs, depending on what that is. And obviously, they are always prescribed by your doctor, by a psychologist, psychiatrist, and all those different things. But what sort of, I suppose, things do we need to think about when it comes to medications, and particularly cerebral palsy, because we know sometimes they do actually impact what movement looks like?
Yes. So that's a big thing. For some medications, definitely looking at if it impacts spasticity, working with your doctor, who's your primary doctor for your CP, working with your primary doctor with your CP, your therapist, and then also the psychiatrist. And ways that this can look like is by the doctor, like your primary CP doctor, sort of compiling about like what your CP looks like, the medication, and like creating a document around that. And you can talk about that with your doctor in a medical visit, and then also asking your therapist to sort of provide the same, like a document, just doing a concise view of what your mental health, what are the triggers, what are your coping skills that you've utilized, and what are some of the symptoms and your diagnoses. And then also then bringing this all to the psychiatrist, and the psychiatrist looking at this and seeing, okay, how can I work with this? And then the very, very truth, it's a lot of trial and error. It's a lot of trial and error. I wish it wasn't. I wish it was like, this medication is for sure going to work for you. But when you have like a good healthcare team, or just even one really good provider that you can go to, you can like say to them, like, I'm not sure, this is not working, even with your therapist. Because a lot of the times for therapy to really work, you have to feel that your therapist cares about you, and you care for your therapist. And
yeah, it's a really important relationship and that bond to form. And I think the piece is to go, okay, if, for example, that medication is causing your spasticity or your movement patterns to worsen, or you're seeing different symptoms, to have those conversations, because there could be an alternative. And I think these are the things to know, is that it doesn't have to be that way necessarily. So to make sure to keep that open dialogue happening and go, oh, actually, I felt so much tighter after taking this medication. Is there something else that could be, might work better for me?
Absolutely. Absolutely.
So, Minnelly, you're a licensed social worker, but
Yes.
can you give us what is the difference between the role of a social worker, the role of a psychologist, and the role of a psychiatrist when we're thinking about care for patients with cerebral palsy?
Okay. Yeah, that's a really great question. So social worker and psychologists are very similar, but we do differ in some aspects, and we differ in the sense that psychologists, they're within the schools, they're within their university doctoral programs throughout their entire time, just really learning all of the facets of psychology, and it can be a little bit more of the cognitive brain, looking at like how emotions, interactions, all of that, how that impacts their mental health. And with social workers, we're looking more at like systems and care management and crisis intervention and making sure like things that are urgent needs are being provided to patients. Now, where we are similar with psychologists is that if we would want to do more of a mental health, like credentialing and licensing, then we would have to do, similar to psychologists, we would have to do contact hours and education and supervision in order to be credentialed into being a clinical social worker, LCSW, to provide individual therapy.
No, and I think this is really important for people that are looking at going, okay, how do I find someone that's right for me in my area? To make sure that people do have the right credentials and that people do have the right education for what they're looking for. And yeah, it's just really important. So, what's then the difference between a psychiatrist?
Oh yes, a psychiatrist. Left out my friend psychiatrist. With psychiatrists, some of them do provide individual mental health counseling, but majority focus on medication intervention, and they'll work with a psychologist or social worker who is an LCSW to be able to provide the right medication to the patient. But majority of the psychiatrists just focus on medication management in regards to mood, but some do provide individual therapy.
Okay, so really like looking at a team approach,
Yeah.
is ideal. And we've spoken about that already today, thinking about, well, how do you have a team approach between your specialist who is looking at cerebral palsy and that management, and now thinking about who is going to be your person within mental health. But it sounds like a social worker can be a really wonderful person that can connect that together.
Yeah.
Because as you mentioned, like the systems change and actually thinking about sort of the management of all those different pieces. Is that sort of how you see sometimes a social worker can be really powerful and can be there to actually help you advocate as well?
Absolutely. I think that one of the things that I particularly love when it comes to social work and working with the CP community is that I look at it as like I'm a partner. I'm a partner of whether you are advocating for yourself in this situation of like you can come to me for tips. And actually, now that I think about it, it just happened like yesterday where somebody called me. I was like, I'm struggling with this. Can you provide me some tips on how to advocate for myself in this particular situation? And we worked through it. And then I also gave them some inside tips of like, hey, this is how this agency thinks. And when you
Yeah.
say this, this is what they think, and this is how they hear. So, in some odd way, we are a translator of social services to the CP community.
Well, it's that broader aspect as well, right? So mental health is one part of obviously the different services that you provide, but it's a much broader sort of look, I suppose, at the whole system and making sure that that support system is provided as well.
Yes. Yes. With psychologists, one thing that I'd like to add is another thing that they are really great at is there are also neuropsychologists where you can do cognitive testing where they can look at your brain and a particular battery that is being administered will look at, okay, this is where your attention is being impacted, this is where your focus is being impacted, or your insight and judgment. So that's another piece that psychologists do that us social workers can't do, which is why we're so lucky to have them as part of the team.
Yeah, and I think there are things that, if families are listening, probably different things that maybe had been assessments throughout at different stages of your child's life, or if you're an adult, even your adult life. And that, as you said, these assessments and testing are actually really valuable tools because it can start looking at going, okay, actually your attention's really good, but maybe the processing is where things are, can be difficult and things like that. And can tell you a lot. So, no, I think the final message that I'm getting from this is obviously a multidisciplinary team, finding your home, finding your medical home, finding the place where you feel very supported. As you said, even if it's just one person within that who can help you advocate, who can help be that person to help you navigate the system, is just so important and so powerful. And obviously the Weinberg Family Cerebral Palsy Center and everything that you provide there, you know, it's wonderful. But I'm sure we'll get questions. If people are outside New York City, can they come see you?
So we see patients within New Jersey, Connecticut, and New York. So for telehealth in particular, but let's say if you're outside of the United States, I mean, outside of, let's say these areas of like New Jersey, New York, Connecticut, you'd have to come in. You're more than welcome to come in. We love that people's coming here to visit us. Trust me, all of us, we love it. But you would have to come in. For telehealth, it's more New Jersey, New York, Connecticut.
Sure. No, and I think this is important. And for those that are unsure or they want to reach out to the foundation, we can help you connect to potentially other locations that are more local to you, that might have some of these services as well. But Minnelly, just thank you so much for joining us today. Thrilled to obviously have you join the team at the Weinberg Family Cerebral Palsy Center and, you know, talk about this really important topic, because I think it's something that sometimes gets pushed to the side, but it is so important to make sure that we're looking after our mental health, whether it be ours personally or thinking about our family unit as well.
Absolutely. Thank you so much. And just to quickly highlight, great resources are betterhelp.com, Headway, Alma, Psychology Today, and a few others that are slipping my mind, but they're really great in regards to finding a therapist that accepts your insurance or that you can start working with at least the next month.
Sure. And we'll make sure we put those all in the comments so that you can link out directly. Okay. Well, thank you so much, everybody, for listening. And again, Minnelly, thank you so much for joining us.
Thank you. Take care, Rachel.
Thank you.
Bye.